Welcome to Thursday's edition of COVID-19. With public inoculations underway in quite a number of countries across the world, many are hoping the campaign will end the pandemic and boost economic recovery. Now, we have more on these hopes later on in the program. Here first is the broader pandemic coverage with our Kwon So-ah. Now, so I believe there has been little change in numbers for Korea on this Thursday.
Right, Shani, it's just a slight decline in infections from yesterday as the country reported 445 infections as of 12 a.m. this Thursday. 427 were domestic transmissions and 18 imported cases, and out of those, half were detected at the nation's air or seaports and the other half during a self-isolation period. Now, for the second consecutive day, we are seeing cases in the 400s, but at least we are seeing a slight decline here, whereas last week we even went up to the high 400s. And with that, the country has a total of 97,294 infections and the death toll at 1,688. And out of a little over 6,400 people remaining under treatment or in quarantine, 100 patients are currently in serious or critical condition. Now, roughly a quarter of the cases we're seeing in recent days have unknown sources of infections, and for weeks the country has been dealing with scattered virus transmissions during day-to-day settings, and some recent cases were linked to a singing room in Gyeonggi-do province and in the capital Seoul, a golf meeting, and also more infections were reported at a public bathhouse in Gyeongsang-Namdo province. So let's take a closer look at our map now. We have 159 infections in Gyeonggi-do province, followed by 124 in the capital Seoul. Also here in Gyeongsang-Namdo province, 35 new infections, and in Chungcheongbuk-do province with 8 new cases. This part of the country has now surpassed 2,000 infections in total.
Right, and so I see that the greater screening centers, that is, in the Greater Seoul area, account for the largest number of COVID-19 cases.
Exactly, Sunny. If we take a look at the total number of COVID-19 screenings that were conducted on Wednesday, that's a little over 76,400, and more than 46,000 were conducted at regular test centers and almost 30,000 at makeshift centers in the capital region. Officials say out of 299 cases in that region, 66 were confirmed through these tests at the temporary test sites. And meanwhile, on the vaccine front, we have a total of 641,331 vaccinations completed here in the country, with a little over 18,700 yesterday. Let's also take a look at the global figures. Now, we are seeing quite a surge here in infections, almost 580,000 infections in the past 24 hours. That's a rise by around 100,000. And let's take a closer look here. That's due to resurgences in many countries. Here we're seeing the countries with the 20 highest numbers of infections. Let's break it down into the daily increases here. We have the U.S. here with over 102,000 new cases reported, and Brazil, a record high of 90,830 infections. This country has also seen its record high of daily deaths on Tuesday with over 2,800 fatalities and also around 2,600 deaths on Wednesday. And France also now set to be in the third wave of the virus with over 38,000 new infections. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Sunny?
Right, so I'll see you back at the desk. Right, back at the local front, authorities here in Seoul are amping up their response to cluster infections at workplaces. And for more on these efforts, I have our Kim Jae-hee here in the studio with me. Welcome, Jae.
Good afternoon, Sunny.
Right, so Jae, Seoul is seeking to better stem the spread of this virus.
That's right, Sunny. The city of Seoul has issued an administrative order that mandates COVID-19 testing on all foreign workers in the city by the end of March. The move comes just a few days after Gyeonggi-do province drew up a similar order last week. The testing began yesterday, and special temporary screening centers for foreign workers will run every day from 9 a.m. to 5 p.m. Those who refuse to get tested could face a maximum fine of 2 million Korean won, which is about $1,770 US. The city says the move will help with the early detection of cases, mitigating the risk of cluster infections among foreign laborers in workplaces across the city.
Right, and of course, Shay, preemptive testing is encouraged for all Koreans as well, right?
Of course.
Right now, I believe concerns over AstraZeneca's vaccines continue in Europe. Tell us a bit about that, Shay.
Right. Although no direct links have been confirmed between vaccination and blood clots, more than 20 countries around the world have either partially or fully suspended the use of AstraZeneca vaccine. Austria stopped using doses from one batch of AstraZeneca vaccines on March 7th after a nurse died from severe blood coagulation disorders days after getting her shot from that particular batch. The same batch had been delivered to 17 European countries, and several of these countries also suspended the use of vaccines from this batch in the following days. On March 11th, Denmark became the first country to temporarily stop the rollout of all AstraZeneca vaccine, ordering a 2-week pause. Several European nations followed suit, including Germany, France, Italy, and Spain, along with other non-European countries. But health experts warned that suspending vaccine rollouts amid the pandemic could have dire consequences. The WHO has urged countries not to halt vaccinations, saying the benefits of doing so outweigh the risks. The European Medicines Agency, the EU's drug regulator, has also repeatedly stressed the same point. The agency's expert committee has launched a probe to determine if there is any link between the vaccines and blood clotting and will release the findings of their investigation on Thursday local time.
Right, and Jay, I believe Korea has also identified 2 similar cases post-inoculation, right?
Yes, that's right. Chung Eun-kyung, the head of the Korea Disease Control and Prevention Agency, said on Wednesday that blood clot had been detected during an autopsy of a woman who had earlier received AstraZeneca's vaccine. But health authorities stress there is no evidence to believe the blood clot was caused by the vaccination, nor was the cause behind her death, and explained that blood clots can occur frequently and naturally among seniors. The woman was in her 60s and was a long-term care facility resident. Earlier this morning, the country's second case of post-inoculation blood clotting was reported in a man in his 20s this time. But in the absence of any causal links, Korean authorities plan to continue their vaccine rollout as previously planned. Starting next week, the government will start administering AstraZeneca vaccines to some 377,000 people aged 65 and older who live or work in long-term care facilities.
Meanwhile, Jay, Moderna is now testing its vaccine on toddlers, I hear.
Oh, yes. In its latest attempt to make vaccines available even to children, Moderna announced on Tuesday that it started vaccine trials in children aged from 6 months to 11 years old. The drug maker intends to enroll some 6,750 children in the U.S. and Canada. The trial consists of 2 stages. In the first stage, Moderna will study the effects of different vaccine dose levels in the participants and determine which of them are safe to proceed on to stage 2. In stage 2, it will assess the safety and efficacy of 2 doses given 28 days apart by comparing it with a placebo. Meanwhile, Pfizer is also planning to conduct a trial of vaccine in children aged 5 to 11 years old. Both Moderna and Pfizer have also recruited teenagers aged 12 and older for separate studies, with initial results expected to be released in the summer.
All right, Jay, as always, thank you very much for that coverage.
Thank you for having me.
Right, up next, we are poised to join the regular briefing on the COVID-19 situation here on the local front for this Thursday. Now, authorities are urging members of the public to abide by prevention efforts and to seek preemptive testing should they believe they may have been exposed to the virus. Now, while we wait for the briefing to commence, let's take a look at Korea's second quarter vaccination plan. Inoculations of patients and staff at nursing homes will continue into the last week of March. Starting April, people at retirement homes will receive their first doses, as will the elderly aged 75 and above. Nurses working at schools and staff members at special education facilities, as well as daycare centres, will also receive their first shots during the first week of next month. In the second week of April, all those at centres for the disabled and correctional facilities will be given their first jab of the COVID-19 vaccine. The third week will include those at assisted living venues, while the fourth week will target the homeless. Come May, senior citizens between the ages of 65 and 74 will be vaccinated, as well as flight attendants. In June, teachers at kindergartens and elementary schools will be able to get their first dose, as will people under 65 with pre-existing health conditions. Now, we are still waiting for the briefing to start, so we'll come back to you afterwards with a summary of it.
First of all, we have Mr. Kwon Junuk with the explanation on the briefing. Let us now begin our regular briefing on the COVID-19 situation here in South Korea for March 18th, Thursday. As of today, midnight, we have 427 new local infections and 18 new imported cases. The total caseload now stands at 97,294. And a total of 76,483 tests were conducted yesterday, and among them at the makeshift testing centers in the metropolitan area, we carried out 29,906 tests, and among them 66 people have confirmed positive. And we also have 364 more people making a full recovery, while 6,428 still remain in quarantine. And we have 100 patients with critical or severe conditions, unchanged from yesterday. We had 2 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And as for the updates on our domestic infections, here are the details by region. And in the metropolitan area, we have about 70% of the total cases. And aside from Gyeongnam and Jeju, all of the regions during the past week, we also have seen an on-week increase of our daily tally. First of all, in the metropolitan area, in Seoul's Gwangdong district, we also have a high school. We have 32 cases being confirmed. In Gyeonggi-do Province, Gwangju City, in relation to a recycled clothing selection business, we also identified the first index case on the 13th of March. We also carried out 8 tests, and we confirmed a total of 19 people to date. And in Chungcheong Province, in Daecheon City, in relation to a sauna, we have 51 total cases being confirmed to date. And in Gyeongsangbuk-do Province, in Gyeongsangbuk-do Pohang City, in relation to a church, we have 21 patients to date. And in Gyeongnam Province, in relation to a sauna in Ulsan City, we have 95 patients being confirmed. And in Jinju City, in Gyeongsangnam-do Province, in relation to a bathhouse, we have 199 patients. And in Gyeongnam Geoje City, in relation to a nightlife entertainment venue, we have a total of 58 being confirmed to date. And as for Honam, in relation to the Jeollabuk-do Province, Wanju-gun County, we have 26 patients in relation to a pharmaceutical company. And we also have Gangwon-do Province, Sokcho City, we also have 31 patients being confirmed in relation to a gymnasium. And next, in relation to the R&D sector related to COVID-19, here are some details. First of all, as for the vaccination recipients, we are looking into the antibody development rate, and we also have the main body of the research, and we will be carrying out our research led by a professor at Seonggyungan University, and we will also look into the AstraZeneca and Pfizer vaccine. And by these vaccine, we will be looking at 200 recipients, and a total of 400 people have been collected as the samples and subject for the tests. And going forward, we will be looking at the samples collected from their blood for 7 times for the next 12 months, and we will see how and when the antibodies are developed and for how long this is maintained. And after inoculation for the next 1 week or so, we will be looking at the adverse responses going forward. And also going forward, as for the 3 types of other vaccines, we will also have a similar test and study going forward. And next, COVID-19 therapeutics. Here are some details. As for remdesivir, at 121 hospitals, we have administered the drug to a total of 5,999 patients. And the Recunora treatment, We also administered the drug to about 541 patients here in South Korea. Moreover, last week we carried out a special meeting on the experts meeting on the therapeutics development. And as for the subcommittee for vaccination development, we have also carried out pan-government efforts where we will be cooperating with the private sector, and we will be also looking at the indexes for the antibodies, and we will be providing a guideline for these indices as well as standards, and they will be also revealed going forward. And as for the special subcommittee on the mRNA vaccination, we also agreed to provide a roadmap going forward, and we will be looking into the details of updates of the technologies going forward by specific drug makers here in South Korea. Moreover, the COVID-19 virus sample cultivation, here are some details. As for the new variants, we also have been looking at the 119 samples, which include 95 UK new variants and 60 South African variants. And we will also be having more samples of the Brazilian variant as well. And we will be also applying for the application starting from the 17th of March, was just yesterday. And as for live treatment and live quarantine measures, here are some updates on our safety e-quarantine e-safety reports, and we have seen at the indoor sports facilities, including table tennis clubs and also and also other facilities, we have seen that there were breaches of quarantine measures. For instance, people gathered and they also shared meals and consumed beverages, and people did not wear face masks properly while they engaged in sports in 3C conditions, and also there were no entry log for these facilities, and there was also improper wearing of the face mask by the sports instructors. We would like to once again note that at the indoor sports facilities, people are in a crowded condition under close contact environment, and they also have a poor ventilation at these facilities. And we would like to also highlight that there are also increased travel of respiratory droplets, and we also would like to urge you, if you have any other clinical symptoms of COVID-19, we ask you to refrain from going to these facilities, and also please refrain from dining at these indoor facilities in large groups. And as for the users, we ask you to also, as for the managers, that is, we ask you to restrict the entrance of the users who have clinical symptoms like fever or other respiratory symptoms, and we ask you to protect the safety of the users and the managers and the staff members. Moreover, here are some updates on our status on the COVID-19 vaccination. As of March 18th midnight, we have 18,733 more people receiving their first dose of COVID-19 vaccine, with the total now jumping up to 641,331. And we have also vaccinated about 80.3% of first priority group. And at the nursing hospital, we completed about 86.8% of our target. And at care facilities, we also reached 79% of our target group. And as for the post-inoculation adverse responses, we have some updates. We have 402 new cases being reported, with the total now standing at 9,405. And among them, 9,298 of them are mild or common symptoms after inoculation, which includes muscle pain, headache, and light fever. And we have an accumulated of 81 suspected cases of anaphylaxis, and we have 2 new cases of convulsion, increasing the cases to 10. And up until now, we have 16 cases of death reported after inoculation. We are under investigation. We will be revealing and disclosing the results in a transparent manner. However, at this specific moment, we would like to note that on the 17th of March, we would like to quote what the WHO has announced. In Europe, certain countries have decided to suspend the AstraZeneca vaccination inoculations, and this is because at these countries, they saw some post-inoculation blood clots among the recipients, and this is why some countries have temporarily stopped the inoculation process. However, this does not not mean that there is a correlation between the symptoms with the vaccination itself. And WHO also sees that currently we have the advantages of the vaccinations of the AstraZeneca vaccines far outweighing the disadvantages. So they are also encouraging continuously the inoculation of the AstraZeneca vaccine. And the South Korean authorities will also like to go over the efficacy and the also safety of these vaccines based on scientific evidence. We would like to communicate with the public in a transparent manner. And last but not least, for a while, we have seen a stagnant in number in the increase of the daily cases as for the international community. However, this has been going up slightly. Moreover, in European countries, at some European countries which have rolled out vaccinations even before Korea, they are also deciding to replace a lockdown. And they also say that an ease in social distancing as well as the spread and influx of the new variants are the main causes of such a rebound. And as for South Korea, we are seeing 300 to 400 cases on a daily basis, and we are seeing a lingering of the third wave. And going forward, we will be rolling out vaccines for the high risk group, and we believe that this will decrease going forward the people who have critical or severe symptoms as well as the fatality rate. However, it is also very important for us to contain any other sacrifices or fatalities, and we would like to also continue to highlight the importance of social distancing and make sure to have no influx, constrained influx of the new variants. And starting from this week, starting from the vaccination rollout from February, we have the people who have completed their first dose of the Pfizer vaccines. And among them, 90% of them have seen that after 2 weeks, they will have antibodies. And we believe that by April, that is, they will also have a high level of immunity against the COVID-19. And we believe that this will also help us liberate from the high fatalities as well as the risks of severe symptoms of COVID-19. And going forward, we believe that senior citizens above the age of 60 will reach such a high immunity level. And we believe that until mid-September, it is very crucial. And for us, we need to also contain further resurgence of the virus and also stabilize the COVID-19 outbreak situation here in South Korea. We will be exerting our full efforts to this end. And at the same time, we also have possible challenges going forward. Starting next week, we will be rolling out vaccinations for senior citizens above the age of 65. Last fall, we have experienced during the flu season, we have seen that there are there will be some death that will be reported after post-inoculation. However, that have no correlation with the vaccines. We cannot roll out and we cannot set aside such a possibility. And once again, as for the inoculation, we need to have a different perspective. We need to focus on the medical and a scientific perspective before we approach them in a perspective of looking at the incidents and accidents by itself. And we will be also expecting some more death going forward, especially that could look like to have correlation with the vaccinations. However, the quarantine authorities will have swift and transparent and rational analysis and testing going forward. And going forward for each of the cases, we will be discussing and studying further, and these related information will be disclosed to the public who will be the future recipients of these vaccinations. And for the past 1 year or so, we are seeing a long tunnel and long battle against COVID-19. And against this backdrop, our public has exerted their full efforts to comply with the social distancing measures and the quarantine measures. We thank you once again. We ask you to also continue to exert your full efforts. And to this end, we once again urge you. Thank you very much.
Right, that was Kwon Junuk with Thursday's afternoon briefing. So he also touched upon the words of the World Health Organization regarding AstraZeneca's vaccine.
Exactly. He reiterated that the World Health Organization did mention that there are far more benefits of the AstraZeneca vaccine than the disadvantages, although there are some European countries that have suspended the vaccine due to post-inoculation blood clots. But he mentioned that that does not mean that there's a correlation between the vaccine and the blood clots. And also on the vaccine front, he mentioned that beginning next week, seniors aged 65 and above here in the country will start to receive their vaccinations for COVID-19. And he did mention that there is possibly inevitable number of deaths, but that also happens after vaccinations of the flu. So he said we should not focus on these single incidents, which, however, the government will, of course, reveal to the public in a transparent manner. He also mentioned that by April, there is going to be a high level of antibodies formed in patients, and not patients, in people who got vaccinated and who also got their second shot of the doses.
Right. All right. So as always, thank you very much for that.
Thank you.
Right. A number of COVID-19 vaccines are currently available, with their efficacy ranging from around 60% to over 90%. So what exactly do these percentages mean, and what are the implications in the real world? That is what we seek to answer in this next report.
With a global vaccination drive now in full swing, the question still on everyone's mind is, how well does each vaccine work? Vaccine efficacy refers to the proportionate reduction in viral infections among those vaccinated compared to unvaccinated people in a clinical setting.
화이자나 아스트라제네카 일본의 코로나 백신은 약 4만 명을 대상으로 했어요. 그래서 2만 명은 백신을 주고 2만 명은 다른 백신이거나 아니면 식염수, 셀라인, 다시 말해서 가짜 약을 주는 거예요. 백신 맞은 사람에서는 10명이 걸렸어요. 근데 백신 안 맞고 가짜 약 맞은 사람한테서는 100명이 걸렸어요. 그러면 백신 맞은 그룹에서 원래 백신 안 맞았으면 똑같이 100명 걸렸을 거잖아요. 근데 10명만 걸렸잖아요. 그러면 몇 명을 줄인 거예요, 우리가? 90명을 줄였죠. 그래서 100분의 90이니까 90% 효과가 있다라고 보는 거예요.
To put it simply, if 1 out of 5 people in the vaccine group were to be infected, as opposed to 5 out of 5 in the placebo group, this would indicate a vaccine efficacy rate of 80%. But is it possible to have a completely foolproof vaccine that is 100% effective?
(100% 예방할 수 있는 백신이 있을까? 그거는 뭐 바람이지 실질적으로는 없어요. 왜냐면은 그 방어 효과가 유효한 방어 효과를 우리가 평가할 때 100%가 있는 것은 지구상에 그게 다 그 위험한 감염원이 제거가 되는데 그렇지는 않고 이 임상에서 우리가 확산을 파급을 막을 수 있고 중증 감염을 안 만들게 해주는 유효성이 50%만 넘으면은 상용화 백신으로 효능이 있다. 이렇게 이제 규정을 한 거죠.
Although common sense would dictate that vaccines with higher efficacy rates are better, experts say there are many more factors to consider in determining how effective a vaccine is, aside from clinical study results.
백신을 접종한 후에 코로나에 걸렸을 때 질환의 중증도를 낮춰주는 효과를 기대할 수 있습니다. 이러한 효과는 우리가 지금까지 인플루엔자 백신 접종 시에도 볼 수 있었던 효과입니다. 그리고 좀 더 추가 연구가 필요하긴 합니다만 백신 접종 이후에 감염이 되더라도 몸 안의 바이러스 수치가 백신을 접종하지 않은 사람에 비해서 더 낮게 배출이 되기 때문에 바이러스 전파를 낮추거나 차단하는 데 도움이 될 수 있다는 연구들이 나오고 있습니다.
If you were to receive multiple vaccine doses, would that correspond to a stronger level of immunity and protection against COVID-19?
두 번째, 세 번째 백신 접종하는 거를 부스터 이펙트라고 해요. 그래서 한 2번 정도 이렇게 예방 접종을 해놓으면 내 몸 안에서 그거를 계속 기억하고 있어야 되는 시스템으로 인식하고 갖고 있어요. 그래서 실제로 한 번 걸렸다 나은 사람은 백신 접종 한 번만 해도 된다. 이런 논문도 나왔어요. 그러니까 그게 백신이 이제 내 몸에서 항체 기억이 없어지는 거를 부스터 시키는 역할을 하니까 이제 2번 맞는 사람이랑 효과가 똑같다. 이런 이야기 하고 있고.
Researchers are continuing to work around the clock to study the effects of vaccinations and maximize their benefits towards our broader objective of reaching herd immunity.
OECD는 우리나라의 경제 성장률을 그간 발표된 주요 기관의 전망치 중 가장 높은 3.3%로 전망했습니다.
단시일 내에 내수가 획기적으로 개선되기는 쉽지 않은 상황임을 감안하여 취약계층이 직면한 위기를 버텨낼 수 있도록 피해 지원에 집중하면서 철저한 방역하에 내수 진정 노력을 병행해 나가겠습니다.
With inoculations underway here in Korea, officials are now looking to better balance public health and economic stability. And for more on these efforts, I have Professor Oh Jun-seok from Sookmyung Women's University. It's been a while, Professor Oh.
Thank you for having me.
And I also have Professor Kim Sung-hae from Hanyang University. Pleasure to see you again, Professor Kim.
Good afternoon.
Now, Professor, according to the OECD, Korea is now the 9th largest economy in the world based on last year's economic numbers. Let's begin with the significance of this latest finding.
It might be a good news for a Korean economy, heavily worn and toned down due to the COVID-19 pandemic. But quite recently, a vaccine rollout is likely to provide a major boost for the economic activity. And then economic prospects have improved over recent months with apparent sign of rebound in international trade and then increasing industrial production becoming clear. And then according to OECD, as Sonny mentioned, that Korea GDP has ranked world top 10. It's a $1.6 trillion. It might be a reflection of economic forecast that the Korean economy, relatively speaking, could rebound faster than other economies. Ever since August last year, export recovery has become a buttress of a Korean economy, and then more than anything else, Korean companies managed to do well in the global market, especially in the industry of semiconductor, cosmetics, healthcare, and then medical supplies. But in spite of this shrinking demand in the domestic market, Korean New Deal program has taken effect as an economic driver of economic growth in the area of eco-friendly cars. It shows a 24% of export growth, and then biohealth, 50% of economic growth. Both OECD and IMF expected Korean economy would bounce back in 2021, roughly 3.1% of GDP growth. But we have to admit that there are still uncertainty in the global vaccine rollout remains uneven, with restrictions remain in some countries and sectors. From now on, vaccination determines the direction and scenario of the Korean economy. The outlook for growth would improve if the production and distribution of vaccination accelerate. But the other possibility still exists. Consumer spending and then business confidence would be hit if the vaccination are not fast enough to cut infection rates.
Right. Professor Kim, observers claim that Korea's economy was relatively less affected by the pandemic owing to effective containment efforts. Having said that, how do you assess that is Korea's current COVID-19 situation?
It was true. It was true. Whether we can still say it is true, that is a bit doubtful. In 2020, We had very successful outbreak containment. It's true that our outbreak was smaller than other countries, which applied very strict measures, like European countries, UK, and maybe we have celebrated too early. Now we have almost at the end of third wave, which is much larger than first and second wave, and this wave is more concentrated in the metropolitan Seoul area, so that's much more difficult to control. So we still do have 300 or 400 cases per day, and I'm afraid that without effective vaccine rollout, we may not be able to go back to the past. Maybe this is the best that we can have right now.
You mean keeping the numbers, the daily tally on the 400s at the moment? Okay, keeping in mind what you've just said then, Professor Kim, what do you propose to better tame perhaps a third wave, which has been raging on for 4 months now?
It is being controlled, that's very true, because we had 800, 900 in December, and until January, after January, February, March, it is getting better. But if you only see the numbers in Seoul, also in Gyeonggi province, it is not very much decreasing. And as many people know that there is a fatigue. It has been like this for more than a year now. And even if the government requests public to adopt, okay, now we have level 1, we have level 2, level 2.5, people want change because it has been so long. Now we all get used to do it. For very specific measures, such as, okay, we can't have social gathering more than 4, that is very specific. People may stick to it, but for all other measures, everybody can recall what is my change when we are on the level 1, on the level 1.5, on the level 2, what I'm doing is the same. So asking public to adopt more, embrace more, may be too painful, and it may be too difficult. So my recommendation would to request to the health authority to do more aggressive measures. Maybe we should intensify active case finding. Maybe we should test more. We should not limit to the COVID test for those who have symptoms. That may not be effective. And in line with this, already the Seoul metropolitan government, they're taking action. So we do have more number of testing facilities. We call it as tentative, but it should have some impacts on it. And as we all discussed today, this acceleration of vaccine uptake would be very critical.
Right. Meanwhile, Professor, global entities, as you mentioned, including the IMF and the OECD, they've further raised the growth projections for Korea for this particular year. What do you suppose is behind their upward revisions?
More than anything, I agree with Professor Kim. I also tired of receiving text messages, something like that. But it is true, Korea has a global market-oriented economy, which implies that Korean economy is highly correlated with the global ups and downs. And then vaccine rollout might turn a global economy upward in the sense that rosy forecast comes basically from the optimistic view on the global economy. Let's think about the global market and then the domestic market, and then in the global market, depleting inventories should be restored in preparation for the normal business cycle. So as a result, exports rose 16.7% this month on strong shipment of chips and automobiles. But the domestic market, vaccine inoculation and government relief fund are the factors supporting market demand, but it is not, the effect is not that good. But Korea has a strong digital infrastructure that makes it possible for business and startups to support and sprout untapped business that reduce the need for person-to-person contact. So key plank of 62 billion worth of the Korean New Deal program calls for further investment in robots, drone, self-driving vehicles, and other technologies. This kind of digital transformation goes forward, consecutive innovation that will reduce the need for the person-to-person contact. As such, nighttime delivery services, Coupang, eMart, and then Market Collie turns niche market into the mainstream of new business in Korea, gaining momentum of new growth.
And staying with that, Professor, what are your thoughts about Korea's exports for this year?
Korea's export this year might be under increase because we know that the global economy they depleted their inventories. So, normally speaking, first quarter the trend of Korean export on the rise.
I see. Meanwhile, Professor Kim, as you mentioned, the OECD has also agreed with you that accelerating vaccine campaign is the best economic policy. Having said that, Professor Kim, what are your thoughts on the pace of Korea's public vaccination?
It goes well. I think we should be proud of what we are doing now. According to the media report that we have received around 750,000 of AstraZeneca vaccine and another 60,000 person dose for Pfizer vaccine. So out of around 800,000, we already have reached 600,000 people. So that is not very bad in comparison to countries like Japan. The uptake is quite slow. There are many success factors for it. We do have nationally manufactured special syringe. So this helps the vaccine to be divided in equal doses. We call it as low death space syringes. And fortunately, around January, there is one Korean manufacturer. They are already qualified to produce and to provide for whole vaccination campaign. And also, we do have many good centers around the country. So they are quite well organized. And fortunately, I'm one of the members of the advisory team for the government. So we are doing the monitoring of this vaccination campaign very intensively, and it goes quite well. I just went to one of the hospital yesterday, and the way we organized the level of infection prevention control measures they are taking, and the speed and compliance was excellent.
That is good to know. Professor Kim, what are your thoughts about Korea's vaccine procurement? We've been having reports of global shortages of vaccines.
Oh, that is very valid concern. And I don't want to criticize government on this matter because the vaccination supply is largely depend on how much manufacturers can comply. It's not only Korea. There are many countries who compete for vaccination supplies, and the contracts are already there. But what is happening is that it is very complicated process. For instance, one of the vaccine, we do have manufacturing in Korea. They do make the vaccines, but the vaccine has to go to Europe to be screened, and then it goes back to Korea, something like this. And there are so many countries they are waiting for vaccine, and we do have contract to cover more than 50 million people, but and it's supposed to be delivered in a very timely manner, and there should have been more vaccine even in this quarter. I think 1 more million doses of Pfizer vaccine, but it hasn't arrived yet, and only half of them will arrive next week. And all others, it is coming, and it is being scheduled, but we only know the definite information when the cargo is scheduled.
Of course.
So since everybody is waiting for it, so it is a bit tough situation, but what we can say is that as long as the vaccine is delivered in country, we do have capacity to deliver the service. There is no doubt on it.
Right. Professor, domestic consumption has been quite sluggish here. Now, aside from domestic consumption, which has been sluggish because of the restrictions in place, what else looks to hinder Korea's economic growth, do you think, this year? Very briefly speaking.
Yeah. But more than anything else, it is somewhat awkward to say, but the market demand burst in the semiconductor industry due to COVID-19. Everybody unhappy, but in the semiconductor industry, they are very happy. And the portion of export in Korea, I think the semiconductor is number one. And then think about it, distance learning and telecommuting and then telehealth and the television service, how to enjoy your living room time to the best with Netflix. So when you use a PC or laptop, you have to have a cycle of purchasing a new one and then changing consumption, it increases a lot. So-called, this is a super cycle. So in the semiconductor industry, due to this kind of market demand burst, it could lead a Korean export, and then it could gain momentum of economic growth. But we have to think about another thing. The Korea's healthcare and then cosmetic export soared, of course, due to COVID-19. In case of the healthcare, 38% high in 2020, and then but the number one country of the medicine is Germany, and second is United States, and third one is Japan. But cosmetic export climbed to 15.6%, and then biggest importer is China, and second is Hong Kong, third one is US, and fourth is Japan. Here is a catch. What you have to pay attention at this moment is how to balance the economic diplomacy. Korea is just on the edge. There will be a partner with China, and then there will be a partner totally with the United States. So at this situation, the danger the Korean economy has is that Seoul has to be been sitting on the fence, neither the Washington side nor the Beijing side. This is a kind of a tricky situation for the Korean economy.
Right, a balance is needed there as well.
Right.
All right, Professor Oh, as always, thank you very much for your thoughts. And Professor Kim, thank you for being with us today. Right, we end our edition now amid hopes that an effective public vaccination drive will pave the path to global economic recovery in the near future. Thank you for watching.